The decision to be reconstructed after a mastectomy is a very personal one. Only about 30% of women after a mastectomy ever get reconstructed. It's my opinion that more women could get reconstructed and would benefit emotionally, physically from the reconstruction. In my opinion as a plastic surgeon, it does help alleviate a lot of the pain, emotional discomfort, and the fear that the diagnosis of breast cancer can bring to a woman. So I do think it's underutilized in the United States, and I think a lot of women who undergo mastectomy should be at least evaluated and be given options for mastectomy. That being said, there are plenty of women who never get reconstructed and do great. So again, that's part of that personal decision whether they should be reconstructed or not. Many women undergoing mastectomy are excellent candidates for breast reconstruction. It comes down to making a decision based on the patient's age, desires, the tumor pathology, how aggressive it is when she first presents to a plastic surgeon's office. Even a patient with a very advanced tumor or cancer can be reconstructed. However, often it's at a later date or in a staged approach over a period of time. So that decision is going to be, again, based on evaluation of all information provided to the surgeon, including talking with the medical oncologist, talking with the surgical oncologist as a multidisciplinary type of approach. Great candidates would be any patient who's otherwise healthy with an early stage disease. These are patients who, with very little extra information, we can help them decide what type of reconstruction they'd like to progress with if possible. The timing of breast reconstruction is often something that patients come in asking about. Should they have it done or have part of their reconstruction done the day of their mastectomy, or, for example, if they've come in and they've already had their mastectomy 5 years ago. Some patients with a new breast cancer should wait to be reconstructed. Again, this really depends on the tumor pathology, depends on how they're doing emotionally, depends on how they're doing physically with regards to their health. We like, if we can, to start the reconstruction the day of their mastectomy. However, there are times where we should postpone that based on patient's health, etc. This is, again, is a personal decision. It's one that the treatment team will help the patient decide and then defend that decision for the patient in order to let them know that is the best way to reconstruct that person particularly.